Hey everyone, in this video I'll talk about different nursing pet peeves that really grind my gears. Just like any job you have, there are going to be some things that really bother or annoy you, and that is just the reality. Now, these are just some of them, but I would love to hear what you have to say or think as well. In this channel, I talk about all aspects of nursing, from pre-nursing to postgraduate programs. If you want to learn more about nursing, consider subscribing and giving this video a thumbs up. I would greatly appreciate that. I also have a free 45-day NCLEX guide on my website, www.simplefitnurse.com, that you can download. Don't get me wrong, I love being a nurse, but these are just some of the things that drive me insane. The first thing that is incredibly annoying is putting on bandages where you take out an IV. Often the patient doesn't understand that they need to put pressure on the IV site to stop the bleeding. Even though you tell them to apply a lot of pressure for 3 to 5 minutes, I would say like 70% of the time, the patient always comes back asking why the bandage is soaked with blood, only to find out that they misheard or did not hear that they have to apply pressure on the IV site, and now blood is just everywhere. Another thing that grinds my gears is how slow the computers are. I mean, you're in a rush to constantly do tasks for people, and here you are waiting for the computer to log in half an hour, or waiting for the chart to open for the patient for like 10 minutes. And then as soon as you get to the screen that you need to sign for like a medication you administered, it shuts down or it shuts off. I don't know if there's like a hamster running in the computers at work or what, because every time I work a shift, there's always something that does not work properly with the computers. Now, if you've ever prepared the IV antibiotic pip-taz, or what is formerly called piperacillin tazobactam, you know what I'm about to say. No matter what you do, this antibiotic does not want to mix. I probably spent around like 20 minutes just trying to get this medication to mix with the normal saline, but it just won't work. I honestly feel like whoever made this drug hated nurses or wanted to do everything they could to sabotage a nurse's day. The last thing that drives me insane is drawing up medications in an emergency situation and having to count the vials or drugs in the Omnicell. Imagine if like someone's having a seizure and all of a sudden the Omnicell asks you to count the number of vials of lorazepam before closing the Omnicell. To add on to that, every time you take a narcotic out, you have to count the number of pills in the box. And if you take out a commonly prescribed narcotic like hydromorphone, there is like 100 of them. So you can imagine having to count every single time someone is in any sort of pain and you want to give them a medication. It'll drive you insane. I don't know who thought of this method of taking medications, and I get it. You're trying to prevent them from being stolen, but like this is not the way to do it. Also, the last thing I have to say about the Omnicell is the fact that you have to do med calculations in the middle of taking out a medication. Like, I'm not a math wizard to tell you how many milliliters off the top of my head of medication that I need to draw up. Like, that's just insane. And on top of that, the provider at the bedside decides to increase the dose last minute. You have to fill out a whole bunch of paperwork stating why you're wasting less than what you are. Anyways, those are just a few things that really grind my gears on my shift. Let me know if you agree or if you have any other ones you would like to share. Thank you so much for watching, and I will see you in the next video.